So we share the screen and we go on with the sentences from the article we read. Yes, here they are. And so we stopped with sentence 4, as far as I remember. And let us listen to Rina. Are you here?
Yes, ma'am.
So please, sentence 5 is for you.
Preparation for a DOPS encounter on the part of the trainee need to be very evident.
You choose
Very
evident. Yes, so it should be very evident. You're right, exactly. Well, Bhargavi.
Yes, ma'am. During a DOPS, a trainee may or must not seek help from anyone else. So a trainee may seek help from anyone else.
Yes, may seek, it is, yes. May seek help from anyone else. All right, okay. And then Vidya, please, the last line here.
Communication skills are considered during the examination.
Yes, so we read the criteria and communication skills are considered. Good. And so there are also several questions about the article. Let us try to answer them. The first question, Lahari, are you here?
Yes, ma'am.
So please answer the first question. So the first question is about the purpose of DOPS, right? What is the purpose? So if we have a look at the first, the beginning of the article. So what is the purpose of this DOPS organization procedure? Yes, Lahari?
Yeah, ma'am.
Do you read the, do you see the slide?
Yes, ma'am.
So the answer is given in the first sentence. What does the
The
first...
DOPS is designed to provide feedback on procedure skills essential to provision of good clinical care.
So just the purpose is to provide feedback on skills for clinical care, right?
Clinical care.
Okay, so if we move to the next question, it is for Manish. Read it, please.
How many times a year will trainee be absent?
Do you remember?
4 to 6 years.
4 to 6, yes, and this information is given here where, yes, 4 to 6 observed, undertake observed encounters. Okay. Well, the next is for Pradeep.
Yes, how long does each procedure last?
Yes, do you remember? It's also at the beginning. The number is given.
Yes, ma'am. 20 minutes. 20 minutes, ma'am. 15 minutes for
Yes.
assessment and 5 minutes for feedback.
Okay, it lasts for 20 minutes. Okay. Now Rohita.
What kind of specialists are assessors?
So if you think
nursing staff.
Yes.
Nursing staff.
Sorry.
Nursing staff, ma'am. Like
nursing staff.
Experienced special appropriate nursing staff are consulted in a secondary care.
Exactly, experienced staff. Specialists and consultants also. Well, okay. And now has Bhuvanesh joined us? No. So Hita?
Yes, ma'am.
So,
What competencies are the trainees assessed in?
mhm.
They are assessed for their communication skills and technical abilities. And
Well, so this is just this procedure is organized to evaluate how can
the
doctors,
practical procedure. Yes.
yes, practical procedures, only practical procedures, how they can do these kind of things that was described, yes, here on this slide. Arterial puncture, blood culture, peripheral, central, and so on. So venipuncture and so on, annulation. Well,
Yes.
and so the next person is Sohita.
Yes, ma'am. Which organization created the DOPS? Royal College of Physicians,
Mhm.
RC.
Yes, these letters stands for these name stands for these letters, and I mean that so that will be also part of your home assignment, just to answer these questions in writing, just to focus on one more time on the article to understand it better. Okay, and one more question: what criteria are mentioned in the last paragraph of the article? So, do you remember the criteria? Afnan. Afnan, are you here? Hello. Minus. Afnan is not here.
Yes, ma'am.
Afnan, are you Afnan?
Yes, ma'am.
So please, do you remember the criteria? How the doctors are evaluated? What kind of criteria are mentioned in the text? So this is the information about criteria. So what are they?
Clear demonstration of appropriate preparation before the procedure. And the appropriate analgesia or safe sedation and aspectic techniques, ma'am.
Mhm. Okay. So just demonstration of techniques, knowledge. Mhm. And this is also management skills, post-procedure management, and communication skills also.
Communication skills.
Mhm. Okay, thank you. Mhm. So we've answered all the questions, and now, yes, here they are, the criteria given here. Mhm. And if we move to the next slide.
Listening to.
Just a minute. Here there is we start to discuss the issues about giving instructions. I mean that this is a very essential part of general practitioner, for example, practice, to be able to give clear and good instructions to the patients. We are going to listen to some information and just what the doctors say to their patients, and we should match each instruction with a picture. And you should also, and yes, you should also say if you hear or don't hear. So,
Listening to. 1. Can you just bend your head slightly to the...
do you hear?
Yes,
Yes,
ma'am.
ma'am.
Okay.
Yes, ma'am.
Now, so we are working with the pictures in the first row and in the second row. There are no letters or numbers, but I think we don't need them.
Listening to. 1. Can you just bend your head slightly to the left? Okay.
So which picture is it?
Last picture.
Last picture.
Last
Last
picture.
picture.
Seventh picture.
Exactly. Mhm.
Seventh picture.
2. I'd like you to raise your arm above your head for me.
Fourth.
Fourth one.
The
Fourth
fourth
one, ma'am.
picture.
Fourth
Mhm.
one.
Okay.
3. Now roll your sleeve above your elbow. Yes, that's
Fifth
fine.
one.
Fifth one.
Fifth one.
Fifth one.
The first in the second row. So this
Second
is
row.
yes.
Second row, first picture.
Mhm. Now
4. Would you just pop up on the couch for me? That's it.
which picture is it?
Third.
Third.
First picture.
First. Sure.
First one.
Yes.
First.
Exactly. First. Pop up on a coach. Yes. Mhm.
Mhm.
Well then.
5. Could you lean forward a little bit for me? Good, that's it.
First row, third picture.
First row.
Third
Third
one to third one. Third
Picture
picture.
3. Yes. Lean forward. Then
6. If you could just move towards the edge of the couch. Yes, that's it.
Second row, second picture.
Second.
second picture. Is second picture about moving to the edge, towards the edge of the couch? No. Which picture?
Second row,
Second row.
Second here. Yes, in the second
Sixth
row.
picture.
This one, where the woman is lying on the couch. Okay.
7. Now, I want you to just turn over onto your tummy.
So
First row.
First,
Second picture.
second picture.
First row,
First
second
row.
picture.
Okay.
Second one.
Good. Now we understand so what each picture describes, so what kind of action. Now I would like you to focus on the way the instructions are given by the doctors when the doctors are talking to their patients. So the instructions are not so abrupt as they were in the instructions given to a colleague. And there are a lot of polite words are used here, polite formulas. And I want you to listen to the same information one more time and try to make notes, try to write the sentences that are said by the doctors, okay? So you should prepare something to be able to write. Now I'm switching on the recording and we'll listen twice, I think, just to make sure that we are able to write everything. Now,
Listening to 1. Can you just bend your head slightly to the left? Okay. 2. I'd like you to raise your arm above your head for me. 3. Now roll your sleeve above your elbow. Yes, that's fine. 4. Would you just pop up on the couch for me? That's it. 5. Could you lean forward a little bit for me? Good, that's it. 6. If you could just move towards the edge of the couch. Yes, that's it. 7. Now, I want you to just turn over onto your tummy.
so have you written all the phrases?
Yes, ma'am.
Ma'am, once more, ma'am.
So one more time, let us just listen to make sure that we understand.
Listening to 1. Can you just bend your head slightly to the left? Okay. 2. I'd like you to raise your arm above your head for me.
3. Now roll your sleeve above your elbow. Yes, that's fine.
4. Would you just pop up on the couch for me? That's it.
5. Could you lean forward a little bit for me? Good, that's it.
6.
If you could just move towards the edge of the couch. Yes, that's it.
7.
Now, I want you to just turn over onto your tummy.
Okay, so now let us check. So in the first picture about bending the head, so what was the exact phrase? So I don't remember. Who did we stop
Could
with?
you hop onto the cow?
Would you pop onto the call?
No,
Couch.
I'm just speaking about bending the head. The phrase which
Can
was
you just bend your
Can you
head?
just bend your
Just
head slightly
head
towards the left?
to the left.
yes. Can you just? So the phrase
Can
is
you
used.
just?
Okay. Now the second was about
Can you raise
raising.
your
Just
Can
let
you
us
raise
see.
your hand?
I like you
hand
to raise
I
your
would
like
arm.
to raise your arm above your.
I like you to raise your arm
Yes, I'd like you to raise your arm
above
just
your head.
above your
head.
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 Above your
I'd
head.
like you. Good. So then picture 3 was about
No,
rolling the
rotate
sleeve.
your.
Can you
Yes.
roll
Roll
your
your
sleeve?
sleeve
Could you roll your
Roll your sleeves
Mhm.
above your elbow.
your
above the elbow.
Above your elbow.
Oh, that was another word. Now it was now roll your
Yes,
sleeve above your elbow, right? So then picture 4, which is
Would
the
you
first
just
one,
pop
Would
up?
you just pop
Would
up?
you just pop up?
You just pop up on the phone.
on a couch.
Can you just
Yes.
eat
So would you and for
to
me
the edge of the couch?
polite phrases. Now picture 4. Now picture 5 about bending.
could you lean forward a
Could you
little bit?
lean forward?
Would
Lean
you
forward
forward.
Yes, for me, a little
for
bit
me.
for me. Yes.
Yes,
And
ma'am.
now 6 is about
If
moving.
you
If
could,
you could just move to the edge of the
If you
corner.
could
to the edge of the
just
ground.
You
move.
could just move to the edge of the corner.
Yes, and the beginning of the phrase was if you
If
could
You
just
could.
if you could.
move. And the last one, the
No,
second picture.
no, I just want.
Yes,
No,
I
I
just
just want to move
Lean.
your
Now I
tummy.
just
turn
want
your
turn your
Turn
tummy.
off your
Turn over onto your tummy.
to your tummy. Okay, so this is just
Listening 2.
important to pay attention to these phrases, and there is the information about this. Because giving instructions to a patient by using only simple imperative mood can sound very harsh, very rude if a patient is ill. So, and when we talk to a patient, we use different polite formulas like here. To soften imperatives, we should add for me, please, like in the example, undressed for me, please. Or we should use can or could to make the instruction gentler by changing it into request. Could is slightly gentler than can. And the examples, the construction here is like a question. Can you just plus infinitive plus please? Infinitive should be used without particle to. And the examples are, can you just bend your head forward to me, please, for me, please? And could you just bend your head forward for me, please? So here are the words that we should add to a request to make it polite, make it sound more polite. And so you can also use if you can, or could you just plus infinitive plus please, and infinitive plus if you can or if you could. The examples here, if you can bend your head forward for me, or could you just bend your head forward to me? Or we may add it at the end of the phrase, Just bend your head forward for me if you can, or if you could. So do remember these phrases, and there is also one way, more way to use in this situation is I'd like you to plus verb. I'd like you to just bend your head forward for me, please. And of course, please, we should add this word too. Now, you remember that when we were listening to the doctors talking to their patients, they also used such phrases as now, okay, that's it, fine, just that's fine, good. And so just to make to sound more polite. Now, let us focus on the following sentences, instructions. Decide which of these instructions are inappropriate to use with the patient. Let us read them, and let us start with Musharif, sorry.
Yes, ma'am. You
First line.
just lie on your left side for me.
Is
It's
it good?
appropriate. Yeah, it's good.
Yes,
Appropriate,
it's
yeah.
rather polite. Okay. Then Mayuka.
Yes, ma'am. If you could just pop off your clothes and then I think it's appropriate, ma'am. It's polite.
Okay, some students say that pop off your clothes. This is the just conversational phrase. Do you think it's okay if the doctors use this phrase, kind of slang, talking to their patients? Or should the doctors use?
I think it's okay, ma'am.
Yes, it's okay. So doctors are also human beings. Okay, and let's listen to Rina.
Yes, ma'am. On your left side, please. It is inappropriate on your left.
How can you improve?
I think it's appropriate.
Yes, ma'am. It's appropriate. Please.
Yes, there is please in this phrase.
Please.
I mean, yes, it depends on the context. It's if, for example, this is part of a long or longer phrase where the polite formulas were used, it's okay. But can we just make it more polite?
Please on your left side.
Or can you?
Please.
Can you just lie on your left side?
Yes, like a question. Well, Rina.
Yes, ma'am.
Bhargavi, are you here?
Yes, ma'am.
Okay.
Just bring your leg up to your chest. Yes, like that, and relax. I'm just going to. It can be appropriate, and sometimes it cannot be appropriate.
Well, make your choice.
It's
And
appropriate.
Appropriate.
As we, yes, because we used like that here. So that's the reason maybe it's appropriate.
Okay, yes. Well, and Vidya, please, the next phrase.
Can you just bend your knees towards your chin and curl your neck? It's appropriate.
Because this is polite request. The
Yes.
next is for Lahari.
Yes, ma'am. I would like you to stand up for me if you can. Yes, ma'am, it's appropriate.
Appropriate,
I think.
yes. And Manish, the last phrase, please.
Take off your shirt. No, it's not appropriate because it could be appropriate.
Can you improve this phrase?
Could you please take off your shirt if you can?
Okay, great. So thank you. Now I see that we do understand how to be polite with our patients. And here on this slide, we have to complete the sentences with these with the words. And we should add some more phrases if it is necessary. So the words are make, tilt, pop, keep, stand up, cough, and turn. And the verb tilt means, what does it mean? Tilt. Who knows?
Turn.
Turn.
Turn,
Turn.
bend. Yeah.
Slightly.
Okay. So let us just look at the first sentence. And you see in this sentence there is a word screen. Screen is not a computer screen, as you see. On this slide you can see the illustration. This is a hospital screen where people can hide from somebody, yeah, just to make it not visible how the person undresses, for example. So let us just decide which verb to choose and which the prepositions and extra words to add to this sentence. And let us listen to Pradeep.
Yes, ma'am. Can just to pop behind the screen and undresses for me, please.
Pop
I
up
think pop behind the screen.
I see. Yes, okay. So the second is for Rohita.
I need to examine your lower back, so if you could turn.
Could turn. Where?
Onto your tummy for me. If you could turn, ma'am.
On your tummy, right? Yes. Okay, so the next is for Bhuvanesh. Bhuvanesh, Suhita.
Yes, ma'am. Just cough for me. And again, that's fine.
Only cough, okay. Then Afnan. Afnan, are you here? No, Afnan?
I would like to.
Afnan?
Do you need any help getting up? Stand up, ma'am.
I'd like.
I would like to stand up.
So does the doctor want to stand up himself, or does he want his patient to do this?
For the patient, ma'am.
So it's better to say, I'd like you to
stand up.
Okay.
Yes,
Okay. And now Musharif, please.
Could you tilt the head to your left? Yeah. Yes, that's fine. That's
Good. Well, and Mayuka, please.
Can you make a tight fist for me?
Make a tight fist for me. When do we ask patient to do this? When? What kind of procedure?
Blood test.
Well,
During draining the blood from
and blood pressure.
Exactly.
blood pressure.
Okay, and so number 7 is for Rina. Rina?
Yes, ma'am. I keep. Okay.
I can keep still for me.
I would like you to keep still for me.
I would like you to keep still.
If you can.
If
Okay. Well, actually, the answers are given here.
Listening 3.
I mean, here, and let us just listen to the beautiful British pronunciation.
Listening 3. 1. Can you just pop behind the screen and undress for me, please? 2.
I need to examine your lower back, so if you could turn onto your tummy for me, please. Thank you.
3.
Just cough for me. And again. That's fine.
4.
I'd like you to stand up for me. Do you need any help getting up?
5. Could you just tilt your head to the left? Yes, that's it.
6. Can you make a tight fist for me? Fine.
7. I'd like you to keep nice and still for me if you can. Okay.
So we see to keep nice and still. So there is a phrase. Well, and
Listening 3.
now we are coming to the home assignment. So in this pictures, you can see the cannulation procedure. So this is IV cannulation, intravenous cannulation procedure. The task will be to write a list of instructions you would give to a patient to carry out the whole procedure. You do not teach your group mates, the other doctors or the nurses. You are talking to the patient to make him feel nice and calm. Yes, and you shouldn't use a lot of professional language, a lot of technical medical terms. You should just explain everything in simple words, and you should be polite. So you should use the phrases that we discussed today, like, could you please, for me, just if I'd like you to do something, can you, and other phrases. So you may have a look at the presentation before you start writing the instructions. And you should write the instructions on a sheet of paper, should be done in handwriting. And so you should take the picture of the ready-made task and the ready-made paper, and you should insert this picture into PDF file and upload the PDF file to Moodle site. There is the folder for this task on Moodle site. And this is one of the assignments, and then there is one more. So you remember there were questions. So questions here. You should answer the questions also in written form. This is a separate task. You should do also the same. Write the answers, take the picture of the answers, use the PDF file and upload the PDF file to the Moodle site. So this is about the home assignment you should complete for the next class. And
Okay.